Hi, everyone. I am Angela with Sunfish. I'm delighted to be speaking with all of you today, and I'm joined by the fantastic Dr. Mroueh. We will be talking about Boston IVF and the Sunfish Gold Success Program. So I'll pass it over to our physician in a moment to introduce himself further, but for now, I'm going to begin sharing my screen so everyone can kind of follow along visually. You'll be on mute for the purposes of this conversation. So while we let folks trickle in, I'll just start with a few housekeeping announcements. If you have questions, we really want to make this interactive. You should see a small chat window at the bottom of your Zoom where you can text us a question. We'll be responding to Q&A that comes in throughout the presentation. So that will make it a little bit easier to see the questions that come in. And if you have any questions about Sunfish or Boston IVF or working with us, we'll also be sharing our contact information at the end as well. So it'll be easy for you to get in touch with us, and we'll be sending out a recording. So with that, I guess we'll get started. I'm Angela, the CEO of Sunfish. Sunfish is a company that helps people financially afford parenthood, and we offer a couple products that we'll be talking about today. I personally have gone through several cycles myself, and much of our team has personal connections. We've been in your shoes going through assisted reproductive journeys, so we know firsthand how stressful this is, particularly when it comes to cost. And we've designed Sunfish to offer a comprehensive set of financial tools to help you financially plan and actually de-risk the journey as you go through. I'm really delighted today to be joined by the fantastic Dr. Mroueh. He is the leading physician at Boston IVF's Rochester location and has come from a very prominent fertility care program in Rochester, New York, where he spent over 3 decades working with fertility patients and helping with family building. He's also been recognized by ACOG, the American College of Obstetrics and Gynecologists, obstetricians and gynecologists, and has an incredible academic background. So we are delighted to hear from him today. I also want to introduce his clinic, Boston IVF, which is one of the leaders in reproductive medicine and has supported over 125,000 babies over the past few decades. I'll be talking a little bit about Sunfish as well, but just to kick things off, let me pass it over to Dr. Mroueh. Would you like to introduce yourself first?
Thank you. Thank you so much, Angela, for this nice introduction. So
Yeah.
as you said, I've been doing this for almost 31 years now. And, I love what I do. It's a great profession. I'm always sad when people come to see me for the first time because I know the difficulty they're going through in order to have children. And I always tell them, I hope I'll have to see you only for a short period of time, and you will be leaving soon with a baby or two for that matter. We were very lucky to become part of Boston IVF. Boston IVF has been, doing in vitro fertilization. It's one of the oldest practices doing in vitro fertilization in the United States as back as 1985 or 1987. And I was very happy to join them just because of the depth of research, the depth of knowledge, the depth of technology that they have. And this has definitely, improved what we were doing. We thought we were doing very well. And I think by joining Boston IVF has really made like a big difference to us.
Fantastic. So why don't you tell us a little bit about the clinic and when to consider IVF?
So as you know, the first IVF was done because there was a patient, who did not have her fallopian tubes. So the only way for her to get pregnant was to try to make a baby outside the body and put it inside the uterus because the egg and the sperm usually meet in the tube. So that was really like the first indication for in vitro fertilization. And Louise Brown, the first IVF baby, was born. But since then, we have learned so much more, and we've been using IVF for so many more reasons. We use it for people who don't have fallopian tubes or who have disease of the tubes or who have decided not to have children anymore and tied their tubes and now have changed their mind. So that's one indication. Another indication, very important, is for male factor. In other words, when the man is the reason why, the woman is not getting pregnant because there is not enough sperm, because there is an obstruction, he cannot pass sperm. So what we do a biopsy of the testicle, take some sperm and use it in vitro fertilization. It is done also in people, and those are the majority who have what we call unexplained infertility. In other words, we do all the testing needed and everything comes back normal and we don't know why they're not getting pregnant. And then we do in vitro fertilization. We'll get to look at the egg, we get to look at the sperm, we get to look at the interaction of the egg and the sperm, we get to look at the embryo growing up, we get to analyze the embryo if we need to, and finally we get to put it back where it belongs, inside the womb of a woman. We do IVF also a lot in people who want to preserve their fertility. They're going through studying, they want to follow their career. They're not ready to get pregnant. So we can either freeze their eggs or we can freeze their embryos if they decide to do that. We do a lot of IVF in people who unfortunately have cancer and who need treatment, because when people get chemotherapy or radiation therapy, it may damage or affect their chances of getting pregnant in the future. So what we do in vitro fertilization and we freeze the eggs. More importantly, lately, we do a lot of in vitro fertilization for people who carry a genetic disease. In other words, let's say your kids is at risk of inheriting a gene that might cause breast cancer or ovarian cancer or sickle cell disease or cystic fibrosis or any of those hereditary conditions. So we do that also to try to prevent the birth of a child which is affected by that condition. We do that also, sometimes people may have two boys would like to have a girl, they have two girls they would like to have they have two boys they would like to have a girls, or vice versa. So we do that also for what we call gender determination. So we can test the embryo, see if it's a boy, see if it's a girl, and then put it back inside the uterus. So there are really a lot of reason why we do in vitro fertilization and why people should consider doing in vitro fertilization. Now, it's not a cookbook. Every in vitro fertilization cycle has to be customized for the patient, depending why they're not able to getting pregnant or why they're undergoing in vitro fertilization. So for that reason, we really need to customize it specifically for them.
Great. Thank you so much. That's a wonderful overview. So we'll get into a few more questions as we go through. But first, I want to share a few minutes about Sunfish and the programs that we offer. So our goal is to work alongside with your clinic to help you become pregnant. And specifically, we offer two products. The first is the Sunfish Gold IVF Success Program, which is a really unique and groundbreaking program that offers a guaranteed refund of up to 90% of your treatment package costs if you're not successful. So if you join our program, we'll support you every step of the way alongside your fabulous team at Boston IVF. We'll be providing you with guidance, resources, information about each step, such as preparing for your egg retrieval. And importantly, if you're unsuccessful, we do offer a refund. So on a typical IVF journey, I'll talk a little bit more about what the Sunfish program offers, and feel free to jump in with questions. But on a typical IVF journey, healthy embryos, healthy wombs, we do see it usually takes a few attempts to get pregnant, often multiple cycles. Obviously, we all hope that you'll get pregnant on the very first try in the very first cycle, but just statistically, even with a perfect patient, it does take a few attempts. And because so many of us on the Sunfish team have been there and been in your shoes, we really wanted to help people take that financial risk out of the equation of what's a very stressful journey. So as our as this reproductive endocrinologist, Dr. Jason Yee mentioned, when people are thinking about IVF, the financial barrier is a real burden for them. And so Sunfish is here to be your financial support system throughout IVF. Now, IVF is very common. As Dr. Mroueh mentioned, it's been a technology that's been around for 4 decades, and an IVF baby today is born every 45 seconds. However, it does take people multiple attempts, and we just want to help you plan for that. We, Sunfish, have been around for several years working with families throughout the United States, and we're really here to support you as you financially plan for this journey. So specifically, if you're interested in our program, you would enroll with Sunfish. We work alongside your clinic to create a custom package with a guaranteed refund if you're not successful on the first try. So that custom package is for one cycle at a time. You can enroll multiple times. We will help you with the retrieval, where you get the eggs, make an embryo, and then with the transfers. And if you enroll with us, we'll provide you with a custom refund rate, which would be up to 90% of your treatment package. In addition, we can give you financial support. We have humans that will help you along the way, and we offer loans if you need financing. So the financial burden is a big piece. On top of that, just preparing logistically, understanding all the steps, what you're going to need in terms of time off work and how to prepare are things that the Sunfish Gold program will offer you as well. So when I went through this process, I was always getting questions about, what nutrition, what vitamins should I do? What are good questions to talk to my doctor about? How much time do I need off? Those are all of the logistical things that Sunfish will help you with as well. So just to be really specific, and I do see a few questions coming in. Thank you guys. We'll respond to all of those shortly. But just to be really specific, if you wanted to work alongside us, you would meet with your doctor, Dr. Mroueh, or whichever Boston IVF doctor in the New York area you're working with, understand kind of your unique biology, and then Sunfish would create that custom financial plan and guaranteed refund for you. We would work with you to cover, this is all included in the package, your egg retrieval, where your eggs are taken out, preserved, and then created into embryos. There's often some additional testing, and we're actually flexible on that. It's not required for our program. And then you would go through embryo transfers, and our package actually now includes unlimited transfers during your membership, which is 1 year. And you would ideally graduate to your OBGYN when you become pregnant. But if you are not successful at any of these points, if you don't create enough embryos or healthy embryos, or your transfers don't work, you would be triggered the full refund amount, and you can use that to try again if you wish. So that's a little bit more about us. Our program costs about $2,000 more than just paying a la carte, but that's guaranteeing a refund of up to $15,000 if you're not successful. So I would love to open up to questions now. If you do need a loan or financing, or you only have partial coverage through your insurance, we can also help with that. We do offer financing of up to $100,000. And all of these programs are available at all of the Boston IVF locations in Albany, Syracuse, and Rochester. So you're welcome to work with us and the Boston IVF team in any of those locations. We're often up in the upstate New York area. We were just visiting Dr. Mroueh's team, so you might see us around the office as well from time to time. And if you're interested in learning more, this is our website, joinsunfish.com/gold program. You can also just go to joinsunfish.com and set up time to chat with us right through our website. So I'll send out that link in a moment. With that, I would love to pause for questions. We always try to leave plenty of time for Q&A. So I'm going to stop my share here. I'll pull this back up in a second at the end, just so everyone can see our contact information again, and we'll send that out. Oh, shoot. Is my video working here? Let me see if I can get that. Okay, great. Hi, everyone. So, thanks for tuning in. Like I mentioned, I'm Angela, the CEO of Sunfish, and I'm delighted to be joined by Dr. Jamil Mroueh, the leading reproductive endocrinologist at Boston IVF's Fertility Center in Rochester, New York. Thank you guys for being so active. We've had a number of questions come in through the chat feature as we've been talking. So I'm going to pass a few of these to you, Dr. Mroueh. The first one that has come out for you is, what are common misconceptions when it comes to IVF? I guess this person just wants to know if you can just share a little bit about fact versus fiction when it comes to pursuing IVF.
Sure. First of all, I just want to say, Angela, thank you so much for your presentation. And one of the most important unfortunate factor that we encounter, is the cost of treatment. Medicine is expensive, medications, all of that is involved. And a lot of time we lose patients because they just cannot afford their IVF cycle, they cannot afford their dream. And I really, really, working with you with the Sunfish program is a blessing to say the least. I mean, it's going to help so many people. And thank you for that. To go back to the questions about misconception, it's really important for every patient, once they start their IVF cycle, to have their doctor give them what they expect the success rate to be. You know, we all want the success rate to be 100%. We pray that it's 100%. Unfortunately, it's not 100%. And it's really good for people to get a good idea exactly what are the expectations. It may help with budgeting, it may help with emotional trauma, it may help just strengthening you on this journey, which unfortunately sometimes might be a long one. This is one of the misconceptions. There are honestly a lot of misconceptions. Dr. Google can be very helpful sometimes, but unfortunately, there is a lot of, not very well-meaning people who post things that are not true, that are wrong, and that can be, for example, like we get so many people who call in their 50s asking to get pregnant with their own eggs because they heard about somebody on TV, a famous actress, or, some celebrity who did get pregnant when she was 52. And we really have to go through this, above a certain age, unfortunately, the quality of the eggs is not good enough to result in a pregnancy. And I would say anybody above the age of 46, and I'm being a little generous here, probably may need to consider the use of donor eggs rather than to use their own eggs, because the odds of a conception and a healthy baby are very, 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 very low, to say the least, if not impossible. So that's another misconception. We have a lot of people who walk in the office, with a big bag of stuff that they bought online or from a pharmacy, hoping that it will improve their ability to get pregnant. And Angela, I appreciate the fact that you guys have, some information about supplements, etc., because it's really important. We don't want you to waste more money buying things that are completely useless or that could affect your treatment. So it's always good, check with your doctor, check on the Sunfish, website, or with the people there about what supplements might be helpful and which are not helpful or which are harmful. So that's another misconception about IVF.
Great. Well, it looks like we're getting a lot of questions coming in, so I'll take a few. One that came in is there an age cutoff for IVF, which you already addressed. For our program, we're very flexible. The really main criteria, just because of the data that we have to predict your custom refund rate and financial package, is limited after the age of 40 for the egg source, is that we ask the woman providing her own eggs to be 40 or younger to qualify for that guarantee. If you're using an egg donor, you can be older. And as Dr. Mroueh mentioned, we have seen success with women utilizing their own eggs, their own biology beyond 41 and up. But for us just to be able to calculate with precision what that refund rate will be, you do need to be 40 or under. And the second question was, how can you better understand if IVF is likely to work for you? So every body is different, but the typical process would be you'd come in with a consultation with Dr. Mroueh's team or your Boston IVF team in your location. They would do a general physical exam, such as an ultrasound, blood work, and their team can give you a much better sense of whether or not IVF is right for you and how likely it is to work for you. We at Sunfish are also capturing that information, that data, to calculate your unique kind of financial package and refund. You get a guaranteed refund if you don't get pregnant. So once you go through that screen, we'll give you the financial information, and the care team, the medical team, will give you more medical information about the right pathway for you. Would you like to add anything to that?
Sure. So, the Society of Assisted Reproduction has a calculator that we use. I mean, we use our experience, we use the numbers from our practice, we use the number from the national data, the whole USA, so we can calculate what your chances of success is going to be. We use the reason for your infertility, your age, weight, height, if you had any previous pregnancies before. I mean, there is so much data. We put it all together, and then we can give you an idea what to expect. Again, we hope it will be 100%, but we need to be, give you a number that fits you based on what we know, based on the data, based on the Society for Assisted Reproductive Technology calculator.
And we utilize a lot of that same data when we're calculating your unique chance of success and the refund rate, which we guarantee if you don't achieve pregnancy, you would be getting money back. So we're giving you that information too, but that is a great resource. We got a question about IUI. So IUI is a procedure that might be utilized oftentimes before IVF. And the question is, if everything looks good, you did an egg retrieval that produced 22 healthy eggs. Oh, I guess this question might be about IVF. Perhaps this person can clarify. If you're doing an egg retrieval that produced 22 healthy eggs, what might be some of the reasons that fertility treatments didn't work the first time around? Do you want to offer some advice, Dr.?
Sure. So, I mean, as I said, it's always a little bit hard. 22 eggs is a great number. We wish we can get 22 eggs on everybody. But at the end of the day, it really depends on the quality of the eggs. Like, are they healthy? Are they mature? Are they healthy? What about the sperm? How did it fertilize? Is it developing adequately? And this is really like kind of the frustrating part. Let's assume we got 22 eggs, maybe 18 are healthy, maybe 15 are gonna fertilize, maybe 2, 3, 4 are gonna make it to what we call a blastocyst, which is a healthy embryo. And then when we biopsy those embryos, unfortunately, not all 4 are gonna be normal. We may get one with Down syndrome, we may get one that's completely abnormal, etc. So there are so many factors involved. So while the number of eggs, having more eggs is a good thing, we just worry about the quality of the eggs, how they're gonna fertilize, how the embryo is gonna develop. And finally, sorry about that. And finally, if the embryo is gonna be a normal, healthy embryo.
Perfect. Yeah, I would agree with that. And sometimes even with a perfect embryo, perfect womb, perfect sperm, it's not guaranteed to work on the first try. It does take a few tries. The odds are certainly in your favor, but just in case you, are one of those patients where it doesn't work on the first try, despite everything being perfect, this financial guarantee can really help you try again if you need to. Another question that came in, my partner and I are early in the IVF process and we're seeking reciprocal IVF. So this is when 2 same-sex female partners are looking to go through IVF together, with one person providing the egg and one person carrying. We at Sunfish do offer this program for reciprocal IVF. There is a small additional fee just because there's more bodies to kind of screen and evaluate as you go through the process. Plus, you'll probably need a sperm donor, but it's not a lot more expensive. And Boston IVF certainly has experience working with LGBTQ couples, as does Sunfish. Actually, about half of our customers identify as queer LGBTQ. Dr. Mroueh, do you want to speak to that further?
Sure, we do that frequently. People come in just because they feel that one of the partner has better quality eggs. She's younger. They may feel that her eggs are going to increase the success rate. Uh, Unfortunately, sometimes somebody may have inability to carry a pregnancy because of some medical reason, because of a prior surgery, etc. So we do that frequently. It's not complicated, except, instead of working with only one person, we're concentrated on two people at the same time. But we do it all the time, and it's not complicated at all.
Great. Yes, so you would definitely be in good hands at Boston IVF. We got another question. How do you get financing options? So Sunfish does offer loans as well as the Gold program. We offer loans up to $100,000. You would just go to joinsunfish.com. It's pretty simple to click through and apply for a loan. It's actually a soft pull on your credit, so there's no impact on your credit score to just apply. And it's really designed, our financing is really designed to be flexible. So if you're doing the Gold program, it comes to a little over $20,000 to do one cycle. And if you need to finance $1,000 of that, $10,000 of that, $20,000 of that, or none of that, you can use the Gold program. So we'll offer whatever amount of financing you need to go forward. I'll pull up our slides again in a second. I got one other question. When should I talk to somebody at Sunfish in this process? And we always recommend the sooner the better. We work very closely alongside the Boston IVF team. So if you want to start with us or come to us as soon as you've scheduled your first consultation, that's great. We can equip you with all of the information financially. We have all of the details on costs at Boston IVF, as well as pointing you in the direction of pharmacies or any other services you need. So we really like to be a partner alongside the process from the beginning. Okay, one more question for you that came in. What's the best way to prepare for my IVF journey? So I guess any quick tips on getting started?
We want you to be relaxed, and I know it's impossible. I've been doing this again for more than 30 years, and I get stressed with every IVF cycle. We want it to work perfectly. I guess, I always tell people there is no strange question, anything that cross your mind, anything that you have concern about, just call your doctor, talk to your nurses, talk to your doctor 24 hours a day. We want you to be comfortable going through this process. Keep on going with your life. Don't take like 2 weeks off or anything like that. Just keep on going. It will relieve some of the stress off. Because let's face it, I mean, an IVF cycle at the end of the day doesn't take that long, 2, maybe 3 ultrasound and then the egg retrieval. So keep going. Don't change your habit. Just keep going. It will be fine. You're going to get pregnant. Be positive about it. The power of positive thinking. Other than that, I can't honestly suggest anything else.
I love that advice. I know it's hard when you're going through the process. Like I mentioned, I've done several egg retrievals myself, on top of work with Sunfish, which keeps us incredibly busy. But I think that's great advice. It is a stressful process and it's easy for it to be consuming emotionally. So the more you can continue, at least for me, the more I was able to continue focusing on my life and doing yoga and keeping up with other things outside of this process, the less kind of stressed and distracted I was. Let me go back to our slide. So we're almost at the end of our time here. I just wanted to share one more time the best way to get in touch with us. You can email us, you can go to joinsunfish.com to see information or directly to the /gold program page. You can call us or follow us on social media. And for Boston IVF, we'll be sending around their email address, phone number, website as well. So with that, I'd love to wrap up. Any final words before we end here, Dr. Mroueh?
You know, it works. Always remember that. It really works. I mean, it's very, very rare that somebody's gonna leave our office without a healthy baby. So, keep going, do your best. At the same time, it's always good to have, you know, a point in time we're gonna say, I'm done. Uh, sometimes people go through 20 IVF cycle. I've heard about those. Uh, you know, Life goes on, so it works. It really works. Give it your best, but at the same time, have an end point at some time.
That's great advice. And I would just add to that, it works. And the more you can be prepared financially to kind of take that element of stress out of the equation and keep going with a refund, the easier this process will be. So we'd love to be a part of your team to help you. We'd be honored to be a part of your journey. And we bring a lot of that personal experience and empathy to everything we do. So we're really thrilled to be working with Boston IVF and their incredible teams, and we hope we get to work with you as well.
And Angela, thank you again for this opportunity. Working with you, it's just gonna help so many people. Thank you so much.
Thank you. Have a wonderful afternoon, everyone.